At the end of this training, participants will have knowledge about first aid. By the end of this training, you will know what first aid is, its purpose, who a first aider is, basic first aid procedures, and what to do in case of an accident. First aid is non-drug care provided using available means to prevent deterioration until medical personnel arrive. Emergency treatment refers to medical procedures performed by authorized health workers in healthcare units. Here are some purposes of first aid intervention. Ensure safety for your own, for the environments, and the patients. To ensure the continuation of vital functions. To prevent the condition of the patient person from getting worse. The person providing the first aid should reassure patients and reduce fear. Organize helpers. Use available resources to prevent deterioration and provide on-site care for issues such as fractures or dislocations. First aid providers should keep the patient warm and prevent chilling, except in hypothermia or heat stroke. Do not let them see their wound. Perform first aid with minimal movement. Do not move the severely injured unless life is in immediate danger. There are some basic first aid procedures. It involves creating a safe environment, protecting the injured person from environmental risks. Protecting the first aider from environmental risks. Notification is vital in such situations. Notify medical teams quickly and accurately. Stay calm, listen, and answer clearly. Exact address and location, your name and number, incident type, number of injured, age, injury type, general condition, level of consciousness, vital signs, and first aid given. 112 is the first aider's most important support. An ambulance reaches medical personnel faster and safer than any other vehicle. Call immediately and wait patiently. Even if others say they called, call again if possible. The chain of survival has 4 links: calling a healthcare facility, first responder actions, ambulance crew actions, and hospital emergency services. First and foremost, remain calm. Calmness helps you help the patient. Panic upsets the patient and leads to mistakes. Be careful while assisting. If standing, seat or lay the patient. Assess consciousness by speaking and gently touching the shoulder. Response to questions means clear consciousness. Response only to pain indicates partial impairment. No response indicates impaired consciousness. Call 112 and provide information about the patient's consciousness and general condition. After providing information, the patient's mouth is examined. If there are solid particles or liquid waste, they are cleaned, and the airway is opened by placing the head in a position with the chin tilted upward. Head tilt is important in first aid and for the patient situation. Here is how you do it. The inside of the mouth is checked. If there is a solid object in the mouth, it is removed using the fingers like tweezers without moving the head. If there is any liquid in the mouth, the inside of the mouth is cleaned with a cloth. After ensuring that no material remains in the throat, the head is carefully tilted backward. Use the look, listen, feel method for 10 seconds to assess breathing and inform the arriving medical team about the patient's general condition and breathing. Airway obstruction may be partial or complete. Partial obstruction allows some airflow. Complete obstruction allows none and is life-threatening. In partial obstruction, the patient can cough, breathe, and sometimes speak. Do not intervene. In complete obstruction, the patient cannot breathe or speak, is anxious, clutches the neck, and may turn blue. The Heimlich maneuver for adults. The patient may stand or sit. First deliver 5 to 6 firm back blows, then grasp the upper abdomen from behind with one hand in a fist and the other hand over it. Place the fist thumb side below the sternum and compress sharply inward and upward. Repeat 5 to 7 times until the foreign body is expelled. For children, perform the same steps as in adults. Lower yourself by bending one knee to match the child's height. For babies, lay the infant prone on your forearm with the head slightly down. Support the neck and deliver 5 firm back blows between the shoulder blades. Turn the infant supine on the other arm. If no object is visible, apply 5 quick chest thrusts with 2 fingers just below the sternum. Alternate until the object is expelled. Bleeding is blood escaping from a vessel into surrounding tissue or outside the body. External bleeding occurs in open wounds. Internal bleeding is not visible. Bleeding may also occur from natural orifices such as ears, nose, mouth, anus, and reproductive organs. Arterial bleeding spurts and is bright red. Venous bleeding flows or oozes and is darker. Capillary bleeding appears as small bubbles or oozing. For uncontrollable bleeding, compress the nearest pressure point. If on an arm or leg and no fracture is suspected, elevate above heart level. Give shock position and check vital signs every 2 to 3 minutes. Pressure points include carotid in the neck, brachial above the collarbone and in the armpit, arm artery in the upper arm, and leg artery in the groin and thigh. Wrap the severed part in a clean cloth or sterile gauze. Place it in a plastic bag. Then keep it at about +4 degrees Celsius by placing the bag in ice water. Transport it to a medical facility with the patient as soon as possible. Calm and seat the person. Tilt the head slightly forward. Pinch the nostrils for 5 minutes and wait. If bleeding persists, seek medical care. First-degree burns resemble sunburn with mild redness. Cool under running water for 5 minutes and do not apply any substances. Second-degree burns have blisters. Do not burst them. Cool with water, apply nothing, and go to a medical facility. Third-degree burns show charring and are deep. Cover with a clean cloth and transport the person to a medical facility. Do not perform other procedures. Move the patient to warmth, give warm drinks, change to dry clothes, and do not rub or massage. Without X-ray, you cannot definitively distinguish fracture, dislocation, or sprain. For spinal injuries, do not touch or move the patient. Call 112 and reassure the patient. If the injured area is in the foot region, if a shoe is on, immobilize without removing it. If the injured area is anywhere on the leg, stabilize the leg without moving it, using a board or the other leg. Tie knots on the healthy side. If the trauma is in the collarbone, arm, wrist, or hands, if the elbow is bent, suspend the arm with a triangular bandage and secure it to the body with another triangular bandage. If it is straight from the elbow, immobilize the arm using a rigid object such as cardboard and secure it to the patient's body. Do not lift or seat a person who fainted. Keep their back on the ground and raise the legs about 30 centimeters. If they do not regain consciousness within a few minutes in this position, lay them on their side with their face down. For diabetic patients' first aid, if they are feeling unwell, if the patient is conscious and not vomiting, give them sugar or sugary food. Even if the symptoms are related to high blood sugar, sugar should still be given. This is because slightly higher blood sugar levels are not harmful, but low blood sugar can cause death. If someone says their blood pressure is high, calm the patient down. Help them sit down. Help them take any medications they are using. Call 112. If the patient reports low blood pressure, calm them down. Lay them on their back on a flat surface. Raise their feet 30 centimeters above the ground. Help them take any medications they are using. Call 112. For heat exhaustion first aid, move the patient to a cool, ventilated place, remove clothing, lay flat, raise feet slightly, and if conscious, give fluids like mineral water or plain water. Call 112. Seizures have a typical duration and end on their own. Do not attempt to interfere. Prevent head and body injury, do not try to open the mouth, do not restrain, and do not give anything to smell, eat, or drink. In children up to about 5 to 6 years, remove clothing and reduce fever with lukewarm, damp cloths. If needed, place in a tub with lukewarm water. In a situation of chest pain, check vital signs, rest the patient without moving them, position semi-sitting, calm anxiety, administer their medications, call for medical help, and monitor vital signs frequently. Poisoning through the mouth can cause serious problems. If the person has ingested a chemical substance such as bleach, chlorine, etc., do not induce vomiting under any circumstances. Do not give them anything to eat or drink, and wait for medical personnel to arrive. If the person has ingested medication, take them to a medical center immediately. Always take the medicine packaging with you. In cases of food poisoning, take the person to a healthcare center and do nothing else. For inhalation poisonings, ventilate the area, move the person to fresh air immediately, and call 112. Remove clothing and wash with plenty of water. If chemicals are on clothing, cut the clothing off and wash the exposed area without spreading contamination. What should be done for first aid in cat and dog bites? Apply gentle pressure to control bleeding and wash the wound with soapy water. Take the person to a medical center. For bee stings, expect pain, swelling, and redness. If stingers are visible, remove them, wash with cold water, and apply a cold compress. If breathing is difficult, seek immediate medical help. If the mouth is involved, give ice to suck to limit swelling. For snake bites, apply a pressure bandage that does not cut circulation. Do not use a tourniquet. Keep the person still, do not cut or suck the wound, monitor vital signs, and call emergency services. For marine animal stings, do not move the injured area. If a shallow thorn is visible, you may remove it. Do not rub. Apply heat, as these stings are heat sensitive. If a foreign object hit the eye, for dust-like particles, try removing with a damp cloth or blink/rinse in water. For large objects like metal pieces, close both eyes and go to a medical facility. If a foreign object hit the nose, if an object is in one nostril, close the other and blow forcefully several times. If it doesn't come out, go to a healthcare facility. Do not attempt risky removal. If a foreign object hit the ear, do not attempt removal if an object enters the ear. Go to a medical facility, preferably one with an expertise. For drowning situations, open the airway with head tilt, chin lift. Provide basic life support only if you are certified. Once breathing resumes, place the person on their side. Urgently removing swallowed water is not useful. Lungs are not filled with water, and stomach water is not immediately life-threatening. In an electric shock situation, stay calm and secure the area. Cut the current before touching the patient. If you cannot cut power, use insulating materials to separate the patient from electricity. Cover the upper body and do not move the patient unless there is fire or another hazard. Call 112. If the scene is safe, avoid moving the patient unless absolutely necessary. Wait for medical personnel. If transport is essential, keep head and neck aligned and have multiple helpers with one person giving commands.